for you, working in the medical system, being a pathologist and studying where is disease coming from, where's the body kind of breaking down, what what patterns do you see that is the origins of pathology of the body having problems? Where does that is it inflammation or where does that come from in terms of a pattern?
Well, that's the interrogation that everybody has trying to discover the cure of cancer, right? It's multifactorial. I think it's multifactorial. Inflammation is just one branch of or one aspect of it. So in my desk, in my microscope, two main things come to me every day: cancer and inflammation. So, for example, if I'm a neuropathologist as well, so I specialize in brain biopsies. So
Yes.
when a neurosurgeon takes a brain tissue from a patient, I make a diagnosis of certain brain tumor, right? Um, Nobody knows how that tumor reached that point, how it started. We're talking about cell phone radiation, all of that. At the end of the day, I think it's multifactorial. Same with inflammation. Sometimes the patients have uh, encephalitis, meningitis, things like that. So I see the inflammation happening there. But in certain occasions, there is a link between inflammation and cancer, like chronic gastritis and gastric carcinoma is proven. Also, H. pylori. That's kind of like a very strong link. Not all types, there are different types of gastric cancers, but there is a particular type that is associated with H. pylori and H. pylori associated with chronic gastritis. But you cannot tell the same thing for everything that happens in the body. So you can have inflammation like tonsillitis, and
Yes.
it's just like something chronic, but I don't see association with carcinoma of the throat. Sometimes you have HPV in the cervix of the uterus of a woman, and that's linked to cervical cancer. But yeah, it's an incognito, and I feel like it's multifactorial. Some people, and also you have your personal genetic makeup that makes you more susceptible to other things than others.
Okay. I've I've seen I'm familiar with this concept talking about the anatomy of how let's say a tumor forms, which
Yeah.
is there's a concept that's out there that's saying that basically the cells become um, basically toxic or they get intercellular waste that becomes toxic and that the mass that's formed or the tumor or the blob that's forming is basically like a buffer that the body is forming to almost encapsulate that area to keep it to, from spreading or from the toxins getting to other areas of the body.
Yeah.
What are your thoughts on that?
Yeah, I mean, it's a good theory, I would say. At the end of the day, if you analyze an individual tumor cell, is a crazy cell, like it's self-dividing, is independent, like it no longer obeys the rules of that tissue, because the cells are self-contained. Like if, in my skin, if one of my epithelial cells of my skin, they're just gonna evolve to the surface and they're gonna desquamate. That's the cycle. But
Okay.
if I have skin cancer, that cell never matures and becomes a squame. It just keeps proliferating, and um, I feel like the
Oh,
toxicity and yeah, the toxemia theory and all of this acid base, alkaline and all of that is interesting as to understand that we should be cleaner and that we should enhance the body to be clean and to avoid excesses. But I don't see that theory applying to every single type of cancer. Maybe to
yeah.
some of them, yes. I wouldn't lie. I
Okay.
mean, yes.
So it's more like again, it's not black and white. It's more of like we're gonna play the odds. Yes, if you want to make your body alkaline and get the toxins out, you're putting the odds in your favor, but we can't guarantee, you can't guarantee that you can avoid all these problems. There's no guarantees like that in
There's
this
no
life.
guarantees, unfortunately, and that's our tendency as well. Like we want to find the youth, the fountain of youth, the fountain of immortality, and it's just a tendency that we have. We don't want to die, and I mean, I believe that we can live longer than the life expectancy, and keeping as healthy as possible and functional as possible. And definitely the raw vegan diet, and high in fruit, high in vegetables, leafy greens, and all of that is going to give you advantages to preventing certain diseases, but you also have to pay attention. What are the things that I'm missing from this that probably are going to give me osteoporosis if I don't promote, muscle growth and bone density and all of that. So, I mean, I would rather have osteoporosis than cancer or a heart attack. So it's pick what you want. Like there's no warranty with anything, but it definitely helps. At the end, it's like a healthy metabolism. I know that people use acid, alkaline, and all of that to understand more, especially if you don't have any background in biology or medicine, which is fine. I debated this a lot, but I think it's harming. Like I don't know if it's harming more people just going by this reductionist approach, the alkaline acid, but it's a good way to understand that you need to have a healthy metabolism. At the end of the day, your pH in your body remains at the same level. You can
Yeah.
oscillate to a very alkaline or very acid because you die. So the
Right.
body has systems to buffer alkalinity or acidity, but
Yes.
certain foods for sure, right? Coca-Cola and like every single venom out there that we know, it's gonna be more acidic for sure.
And so then the body will buffer the buffering systems get kicked up and then
Yes.
um so
But you cannot live forever buffering the aggression, right? So that's how disease happens. Like we overload or how abuse those systems.
okay. Okay.
Yeah.